You look thrilled. No, a little bit tired of being at this doctor's office, huh? No, I'm talking about you. I just want to see what this doctor says. I gotta fix this part of my phone case right here. You gotta tell them be sure and stick me and draw blood and put IVs in me and all that stuff. I kind of like having the use of this cane. It helps.
I bet it does.
It does help. It takes the pain right off of me. I felt kind of stupid at first, but now I depend on it. Like if I sit like this, it takes it all off of my hip. I can't even feel it. It's crazy how just that little much leverage can take away. Well, I can feel it a little bit. I can feel it a little bit now. You got a drinking problem. You got a drinking problem, Nicole? Yep. And the other one, the one I go to later on, that's probably going to take 2 or 3 hours.
What?
The one I go to Eastway, it'll take a while. So you don't have to, I'll take you home. Yeah, well, you can't be in on that one anyway. But this one, I wanted you to meet this doctor. He's a good doctor. I like him.
Well, they don't want me to go across town and pick her up.
If you want to, if you feel like it, you can. 1 o'clock. The other day, she's like, I don't care. I don't need you to come pick me up. It's funny getting that teenage stuff. I don't know why he let it bother you so much. She's just a typical teenager. I can't see my chat. Oh, because I probably ain't got much of a chat going on. It's early. So we're going to deal with today we're going to deal with my diabetes, which has went up a level. And we're going to deal with Nicole's belching. We're going to deal with that. We're going to deal with my diabetes today, my blood sugar, and...
Hey.
You got to stick me?
No.
You coming to stick me? Oh, man.
What you coming in for today?
I had a surgery last week. They put in a kidney stent.
Okay.
I had a little complication with it.
Okay, so you're just following up.
Yeah, it was suggested sometimes to come back.
Gotcha.
I'm talking to the doctor about other things too.
Gotcha.
Oh.
Good job. Don't drop that.
Hang on, it's running.
What? 30/74.
Also, I'm only 4 points on the bottom over what I should be. 130/70 is what they like.
Yeah, it's not terrible though. Alright.
Now I got chronic high blood pressure, so
Yeah.
that's good.
Alright, let me get your information here. Jim will be in shortly. You got one ahead of you.
Okay.
Sorry.
I was trying to say. Oh. Oh, at least my blood pressure's not so bad. They put me on the lisinopril for that. And the Dr. Page has upped the dose because my blood pressure was going so high, and ever since he's upped the dose, I've been in regular range. 130/70 is what they want it to be. The bottom part is 74. And I'm only 4 points over. It's not bad at all. When my blood pressure is usually like 170/110. Stroke range. That's great. You're cute, baby. Cute when you're tired.
Hey, how's it going?
What's happening, Doc?
So, feeling better?
Well, I had to go back to the emergency room.
Yeah, I saw.
And they found a 10mm stone, which wasn't there before.
Uh-huh.
They put the stent in. I had a little complication. I went back out there. Now they find stones in my right kidney.
Oh, man.
That's on top of.
I don't see how you're sitting. there.
Well,
With the kidney stone.
And the stent. Okay, so my problem is if you look at my blood work, there's some stuff going on there, and
I'll look and see.
I'm pretty scared.
Kidney stones, man. I've had them twice, and I couldn't sit at all.
Well,
Hurt too much.
And my problem is that these keep recurring,
Right.
and I'm wondering what's going
So
on.
what are they saying about that?
They pulled a 1 millimeter out when they did the cystectomy.
So who is this specialist?
Spencer
you go
Hill.
to? Okay, good.
And he's really good, and they are checking it. They thought it was uric acid at first,
Mm-hmm.
but
What are they, calcium?
they said uric acid stone at first. Is what they told me. Uric.
Well, you said at first.
Well, I don't know what they're going to find when the results come back. So, and that's on top of that arthritis in my back and in my hip.
Okay.
They also showed some calcification in the aorta, colonic hernia.
Mm-hmm.
I mean, you'll see it. And I'm looking at this like, man, there's something going on with my limb part of my body.
Let me look here.
And we can't even get to. I came to you because of my back.
Right.
We can't even get there yet.
I know.
So, and I wanted you to meet my wife. She has a lot of doctor's appointments as well, which is cerebral palsy. And I told her you're a good guy, so maybe she'll change and come over here too.
How's that going for you?
She
Very well.
does really good.
I suffer from epilepsy. For the most part, I'm free.
Oh, seizure free, huh?
Yep, for the most part. I have them every now and then. I went 4 years without, then I had a handful.
What kind of seizures?
Petite moles.
Oh, okay.
Well, she has all of them though.
Uh-huh.
I was drinking alcohol, suffering,
Yep.
being stupid.
Yeah, actually, just
I admit it. I had 3 gram moles, and that was all due to the alcohol.
and it's not like she would get drunk. She would just drink a little, and we always wondered why she was having seizures on like the second or third day of January.
Yeah.
It's because when the alcohol is leaving her system, there's a trigger for her. It's weird.
Yeah, a lot of people, if you don't get enough sleep, that can
I
increase
really
your
don't.
brain's.
I'm always tired.
Yeah. Or, of course, you forget one pill.
Yep, she misses a dose. Yep.
That
So,
causes.
Yep, yes it does.
All right.
my last test result is very. You'll see what I'm talking about.
Sure. Okay.
You still there?
No.
You know? Did you leave?
Oh, Grandma went in.
This does hurt. He's right. I've just been able to ignore it. Let me get up here for a minute. Oh, there we go. Dang, everybody seen Nicole's big yawn?
Oh, I needed to stretch. They won't let me back and go to the appointment.
Yeah, no, it's
Therapy.
therapy. They won't let you do that. It's gonna help me. It's gonna help me get used to not working. Because I don't feel good about it.
And then
Because you know how I like to just go to work and get as much as I can, and then you guys don't have to worry about nothing. And I don't like that. And you've been 17 years of not having to worry about stuff.
I've been 20 years.
Well, it's been longer now because your first husband had more money than me. Didn't like him much, huh? You don't like me either.
Not really. That's for that one.
Oh, everybody see your belly and your butt. Don't you dare. Anyone want to see that? You're getting a little belly on. You got a little pouch. It's comfortable to lay on, though. You're still cute, man. You was too skinny when I got with you. So what was you, like 86 pounds when I got with you? I like you a little bit better with weight on you. You're still a cutie pie, ain't you, baby? It does hurt. Since he said, I don't know how you're sitting, it started hurting.
Jinx.
I don't know.
You ignored it until he said something.
I have to ignore. I ignore it about 70% of the day. So used to that. I'll tell you what. Like I said, I felt stupid with this cane at first, but it really does help. I'm glad the doctor. He was like, "Oh, I noticed your gait is abnormal." I was like, "Man, I don't even have a gait." You know what I mean?
The gate.
Your gait is the way you walk, right? I didn't.
Oh.
He goes, "That's." He did, yeah. I said, "Man, I don't even have a gait."
I'm like, what's a gate?
Yeah. I said, "I don't even have a gait." Yeah, I didn't know what he meant by that, and I should have remembered what gait meant from that one true crime where that guy came in the church and killed that lady. He had a strange gait. But anyways, Melissa Beaver's case. But he goes, "Yeah, I noticed your gait is a little bit off," and I was like, "Man, I don't even have one."
Blood work looked good.
Did it look good? The blood work good?
Yeah. You know, a small kidney or bladder infection, but that's it.
Did you see some of that other stuff? Did you see?
Yeah, it's not bad.
Well, they got the hernia thing going on. Some of the stuff.
Well, that's not blood
Oh,
work.
see, you do this. Just what's wrong? You just like you want to stick her too? Oh, that didn't even hurt.
See?
Oh, do
I'm
it
good.
again.
She's good at
Here,
it.
got it.
Yeah.
All right.
So you're gonna
Okay.
look at my A1C right
I'm
now?
gonna look at it.
123.
You've been good as far as the blood sugar for a
But
while.
well, what they showed me, it was a high on my chart.
It's not high enough to start.
Okay. Okay. Good. Good. Well, that
Yeah.
takes it off.
Yeah.
Not
at all.
I'm seeing all this stuff in there with the hernias and stuff on
Well,
my.
the thing of it is,
my-
you got to get this straightened out.
What do you mean?
Your kidneys and the stones first.
Yeah.
Then I'd look to see if they have results of the stone.
Yeah,
I
that's
didn't
what
see it. Yeah,
No,
so it's
he-
in progress.
They told me it'd take a couple days,
Yeah,
and they did me a favor and prescribed me this cane.
is that helping?
And at first I felt really stupid, but now I like it. Yes.
Okay.
So
I would
they,
do the same thing. Yeah, I'm gonna drag my leg.
I didn't like it at first. Well, it just makes you feel old. But the main reason I came here before I started having this kidney problems was
Yeah.
so you could deal with my back.
Yeah.
Once you see that, there's an issue there. I mean, it's bad. I can't even talk. I lost my job. Yeah, I can't because I can't.
Once you get this resolved, you ought to see a chiropractor, get some adjustments. And
I don't know if they can.
Well, you don't know if you don't go.
Well, I've got ortho set. I've got ortho, but they don't do. They don't.
Okay.
He looked at me once. He told me what the problem was.
What did he recommend?
He set me for MRI, but that's not until
Okay.
September 11th, where they can get.
That's always late. You know, it took
Great day.
me 3 months to get one on my knee.
That's pretty good.
3 months?
Well, the only reason I got this one is because somebody had cancer,
Oh.
and I know that they.
Yeah,
I
and
know that
that's
they,
nice.
Yeah, I know that they take a long time, but I know that the MRI is a little more in depth than the.
Yeah, I'm surprised they're that packed up though. But
Oh,
it's
this
how it is, right?
This thing is horrible. But we thought maybe she might consider coming over here and using you as a primary. Because I'm real crucial with doctors, and I know that you guys can make mistakes, but I like the way he works. So I thought you would like it. But you can always shop around.
I can't even adjust. I can adjust your back. I've seen the chiropractor do my wife a couple times. You'd be my first, but I don't mind trying.
I don't know if I want to.
No, I know.
See how calmly I was like. I did used to go to pipe therapy.
Yeah.
And they would adjust my back and they would put the shock thing on, and it worked. It stayed, but it only lasted a day or two.
Did it?
Yeah, because
I saw mine this morning. Neck shoulder strain.
oh yeah.
I have neck
But-
and shoulder pain all the time.
I don't know how.
Same why I did a while back. Someone hit my car. Then about 2 weeks here, just turned. You know, if you're tight and turn, that's all
My
it
stupid
took.
self was driving with epilepsy. That was one problem. I'd broken this clavicle 5 times.
Wow,
She's wrecked a couple different cars.
man.
I learned my
You're
lesson.
lucky.
I learned my
She
lesson
can't
the
just how to
hard way.
drive anymore.
Sure.
See, in
Couple different
Colorado,
times.
she was allowed to drive. In Ohio, they won't let you have license with epilepsy.
You know, my son, he went upon a wreck they're police officers, in which they hit a pole head on and the engine broke off from the car. And he said it was like 50 yards down the street. I've never seen that.
She went down in a ravine and flew up and hit the side of a mountain in Ellicott, Colorado, and bent our Toyota Corolla. It was a 07 Sport. Bent it completely up, broke her neck because she had a seizure while she was driving.
Yeah,
So we don't let her drive anymore.
sure.
Is that your Audi out there, by the way?
No, it's my wife's.
Oh.
That's even better.
I have 2001 Toyota Sequoia.
Oh, well,
that's
it's
nice
even better.
It is 250,000 miles, going strong, and I like the size of it. It's a freaking motorcycle guy almost sideswiped me last
Oh,
week.
man.
Not me sideswipe him, and he knew I was in the lane on 75. He came over. I had to go to the right to avoid him. I thought, of course, he's lucky I didn't pull up beside him. I mean, how stupid is that? He would have went down, broken some bones. As soon as he went, I went right. He gunned it to get off the exit. I thought, you're stupid.
I don't know, but that Audi is beautiful. I was pulling up next to it. I said, boy, I'd love to have one. I'd love to have the money to be able to afford one, but I'd
Right.
love to have one of those.
It's in good shape. I never park by other cars.
It always parks down there. That's why I thought it was the doctor driveway.
I didn't want to ding. I even once when I broke my foot, had to go to Kroger's, get crutches. I thought, should I park a handicap? I thought, no. Might be a military veteran, no legs, I need it. I don't want my car dinged. So I parked further out. Probably took me a half hour to get in.
To get just to the building.
Yeah.
I try to stay away from other cars too. I don't have nothing spectacular, but it is a classic.
Well, I've had before a different car, but a newer Cadillac guy got out, shoved it, he hit my car 3 times, and he started to walk off, so of course I said something. I'm not violent, but it's the only time I keyed someone. He put me over the edge.
Yeah.
It's like, come on, have some consideration. But that was a long time ago.
Man, we all learn, don't we? So once we get through this kidney stuff and what's going on with me internally and get into the back thing, I don't know.
It'd be so much better.
Yeah, I don't know if I can get the RFC form. You know what I mean? The function capabilities, so I can have that. So
Well, as far as that, physical therapy,
Yeah,
you have to
you
determine that.
you won't be able to.
No,
Well,
because
maybe-
the only thing I can go by is, okay, this is what the patient said, where we get somebody who specializes and
Right.
get their report of, actually, we have the documentation for you.
Can you do something based on what you see in my charges and report, what your medical opinion is? You won't do it? Or I don't know, I'm just asking.
Yeah, oh, no, you can ask.
Yeah.
I always like to get physical therapists that document what you can do, cannot do.
Because maybe after I see the ortho and I keep coming back here, maybe you can refer me to a physical therapist.
Oh, yeah.
Okay, that'd be great.
Yeah.
Because it is causing a problem and I have lost a job over it,
I
so
know.
disability is, I make decent money.
He said he wasn't feeling it till you brought it up.
Yeah, when you said, I don't know how you said it, as soon as you went out for her, I was like, you jinxed me. You jinxed me. Well, so I guess you can see in my report though, that it looks like I went from pre-diabetes to a stage 1 is what it kind of.
Did you check your sugar at home? How it is here, it's not bad. Don't worry about it. Just watch your appetite.
I'm afraid to eat anything. And it's saying that I've got blockage, which is normal.
Yeah.
I'm afraid to eat anything because what is it I'm putting in my body? It keeps my stones.
Well,
Come
the
back.
thing of it is, what are they? Uric acid or calcium?
If it's calcium, then you can deal with it.
He's been
Right.
drinking a lot of,
Same for the uric acid.
We could-
You can go uric acid diet and that decrease the intake of it.
Right. I've been doing the lemon water and I drink nothing but water now, lemon juice. And I also, somebody said that the apple cider vinegar tabs,
Mhm.
as long as they're not too much, every other day I have 1 tab, it's 1,200.
Uh-huh.
Every other day I've been doing that. And when they put this stent in, I thought it was coming out. There was something going on. I mean, it hurt bad.
Oh, I bet.
And they said it was normal, but I had stones going in the right side.
I cringe just knowing it.
I cringe
Based
it.
on what I do.
I'm freaking out over renal failure, kidney dialysis, which I know this is probably the beginning of kidney disease. I know it's got to be damaged. So I've accepted the fact it's probably the beginning of some kind of kidney disease.
So I just say it'd be nice to know what the stone is made of, so you can adjust your diet and increase the.
When they remove this thing Thursday, which I'm not looking forward to.
Oh, no.
But some people, my dad said it didn't hurt him a bit. He was just embarrassed because the nurse did it. But then I'll talk to Spencer Hill a little bit more. I'll know exactly what it is.
Exactly, and dietary changes.
I'm afraid to eat. I don't. I'm scared. I know I've lost weight because I'm scared to eat. And it was hurting so bad, so bad. I'm glad I had this actually. Of the back pain and the kidney pain all in the same
You know,
spot.
it makes me mad that freaking Soyan, when I went in, they came into the room prior to the doctor, asked for our credit card. I'm like, give me a break, you know? I mean, how good is that, right? That's good patient care there.
So I guess you're just gonna wait and see what the blood thing is, and then I'll be okay.
Let me see if we can. Are you in at A1C? No.
Then what do you want for lunch?
Your blood stick was good.
Okay.
So don't worry about that sugar. It's good.
It's driving me nuts.
Just find out what the stone is.
That's where we're at?
And change your diet.
Okay, I'll find some.
Drinking Gator Power and Zero with the surplus.
Yeah, I was looking at because I stopped drinking the pop, right? About 3-4 years ago.
I drink Propel.
Well, there's something in there. There's an ingredient called sucrose, and that has been known to cause kidney problems. I mean, I don't take everything literally, but if I see that, I'm gonna go away from
So
it.
you increase your water in.
That's all I drink now, and I'm on a lot of different medicines too. So maybe one time we can go through that after I see the urologist.
Yeah.
After the 11th, or after I go back to Spencer. I'll get with you. I left you messages on my chart, and I understand that you get busy, but I'll try to communicate with you through that. If, you know, that way, if you think
And
I
let
need
me
to come
know, it'll be in the chart, but let me know what the stone is made of.
and then you can go from there.
I'm sure.
Okay. And, all right. And
And I just cringe with this.
it does hurt,
It
man.
feels like someone.
I'm like an alpha male. I can have pain and just not show it. But it
I
hurts.
waited 5 hours to go to the ER because I wanted to stretch it out. And we get there, I tell my wife, don't check me in. I'm going to see if I can pass it. But then I came back and I'm like, I can't even think about it.
It hurt. Do they hurt? They do hurt. All right. So I'll just wait and see what she wants, or am I good?
You're good.
All right. Have a good one. Thank you.
You too.
Ah. And that's that.
After we came in.